Good afternoon, and welcome to those who are joining us live. Welcome to our next episode of Live and On Call with Lake Charles Memorial. My name is Allie. I am your host. I am not the physician who's on call, but I'm so excited to be here with you live. If this is your first time joining us, let me tell you a little bit about what to expect. We'll start with a discussion about today's topic, and then we'll take some time for some Q&A. So you submit questions in the comments below, anything that you think of, thoughts, questions, comments. We're all here to learn, so don't be afraid to ask questions. I promise I will personally be asking a lot of questions. So we'll discuss the topic as things come to mind. Go ahead and share your thoughts and your questions in the comments below. So as people are joining, let me introduce today's topic. It's called Get Your Head in the Game. We'll be discussing how to keep your young athletes safe by improving prevention, recognition, and response to sports-related concussions. We all can agree that sports are an excellent way for kids and teens to stay healthy and learn important leadership and team building skills. But often young athletes don't recognize their own limitations, especially when it comes to sports-related concussions. we as bystanders, but you as coaches or as parents play an important role in preventing concussions and responding appropriately if they do occur. Having the knowledge and resources to better understand the impact of concussions will keep your kids healthy, active, and thriving. Today, we are joined with a special guest, Dr. Brian Harrell. He's a family medicine physician and the director of sports medicine at Lake Charles Memorial. Dr. Harrell is live and on call for you today. Let me bring him up on the screen. Hey, Dr. Harrell, how are you doing today?
I'm doing well. How are you?
Great. Thanks for joining us.
Sure.
I know today we were talking about something that you are very passionate about, something that I think we all need to learn a little bit more about, and also probably something that you see come through your doors a lot as well.
Oh, yes. I see quite a bit of them, especially during football season.
And even though high school football season's kind of wrapped up, sports injuries happen all the time, and specifically concussions can happen in things that don't involve sports at all. So I'm glad that we can kind of talk about this and dive into this. But before we go too far, do you mind taking a second to introduce yourself a little bit more and maybe share a little bit about your practice and the patients that you see come through your door?
Sure. Okay. Well, my name's Brian Harrell. I am actually a physician who is trained in family medicine, but also did a sports medicine fellowship. So I guess maybe just talk about my background. I'm from Lake Charles originally. I was actually born at Lake Charles Memorial Hospital. And then I went to Moss Bluff Elementary, Middle School, and Sam Houston High School. I did play sports, even though I'm somewhat small and diminutive. I played football, and people sometimes get a shock whenever they see me and said, "You actually played football?" Yes, I did. I had concussions myself, probably had about 3 or 4 back in the day whenever they told you to get back in there. And then I went and did my undergrad over at LSU. And so I do bleed purple and gold, although I did grow up coming to the Cowboys games as well. I then went and did my medical school over at Texas A&M and in College Station, and then Temple, Texas for the last 2 years. Graduated from Texas A&M College of Medicine, and then did a residency training in family medicine here at Memorial, and then subsequently went and did my primary care sports medicine fellowship training over with Baton Rouge General over in Baton Rouge, and the affiliate of LSU Athletics. And so did that for a year. I then taught here within the residency program that trained me in Lake Charles for about 3 years, and then became the associate program director for the sports medicine fellowship over in Baton Rouge, and was affiliated with, became the head team physician for Southern University, helped out also with LSU Athletics. I guess I was there for about 6 years, ultimately became the program director for the residency program there, but decided to come home predominantly because, I missed home. I missed Lake Charles, and I wanted my children to have the same experiences I had growing up, where you go fishing and you go water skiing on the Calcasieu, and it's a good place to raise a family. And so decided to uproot my family from there, from the big city, and move back to Lake Charles. And I'm actually teaching in the residency program again here with Lake Charles Memorial Hospital. So I feel like it's a really good program, and help out with a lot of sports medicine and a lot of these kids on the sidelines on Thursday nights, Friday nights, and throughout the year, and have my own clinic as well. So I guess that's me in a nutshell.
Awesome. So I guess you've had a lot of experience with sports related injuries.
Quite a bit, yes.
So just a reminder for those of you listening today, if you have any questions that come up, anything that maybe you're thinking of or you want further clarification, please go ahead and drop those in the comments below and we'll get to them in just a little bit.
Yeah. And I am a family doc, not just a sports medicine doc. So if y'all have any other pressing questions, whether they be not just about concussions, but other sports related questions, feel free to, ask me. I'm a physician. So.
Right. This is a very unique opportunity to have your physician live on Facebook right now to ask anything. So we might be careful with that, but we're also we're excited to be able to offer that as well. Before we go too deep into, let's define some terms, Dr. Harrell. What is a concussion in layman's terms?
Okay, so there's a few synonyms. There's concussion is synonymous in the medical field with mild traumatic brain injury. That's to separate it from traumatic brain injury. I'll give you a medical definition and then I'll kind of explain exactly what it is. It's a transient alteration in mental status that tends to have a sequential progression of recovery. What that means is that it's ultimately some force from outside you gets transmitted to you, specifically the brain, and then you have this transient, meaning that it doesn't last forever. It will ultimately resolve, but change in consciousness on some level. It doesn't have to be loss of consciousness, but change in mentation. So it can be something as just not feeling right. It can be seeing stars. It can be many various things that we can probably talk about later. But ultimately, when it comes to concussion, it also has I can pretty much tell you by your symptoms how you're going to progress upon recovery, in the road to recovery. So there's this typical sequential road in progression towards full recovery from the traumatic event. It separates it from the traumatic brain injuries, which typically get rolled into the emergency department for things like motor vehicle accidents and fall from like significant heights and things like that. Sports-related concussion is a subset of kind of like concussions in general.
Gotcha. So how does a concussion affect the brain and the internal functioning of that?
Well, it's important to recognize that it can affect just about everything. I mean, your brain it regulates so many different things in the body, but it also makes you who you are, and it deals with so many different things from a primary and a secondary perspective. And so if you can pretty much think about it and you question, well, can that be a symptom of a concussion? Probably the answer is yes. Okay. So, and it's global and it affects the entire brain. When a force comes in from outside, your brain is cushioned. The skull itself is incredibly thick. And then you have levels from skin, a little bit of fat tissue, and various levels. And then your brain sits in cerebrospinal fluid. All of this is has structural reasons, but it also is to cushion and safeguard that brain. When the brain gets jostled, I guess you could say, what ends up happening is the nerves, and you've got billions of nerves in your brain alone, they undergo shearing forces. And it occurs like that. Drawn out, you can think about it if you've ever been through a hurricane, which a lot of us have been here. You remember the winds coming through, and you see the trees just kind of like do like this, and they get sheared. That's shearing forces. Same thing happens when it comes to the neurons or the nerve cells in your brain. So it's that, and it's not specifically to like one specific area. What ends up happening is your brain immediately begins to shut things down and turn things up in order to start regulating things in order to try and safeguard yourself and safeguard and initiate the healing process, and as well as the inflammatory process. So all that being said, you'll have people not knowing where they are, they're not knowing who they are, They can have amnesia. You can have loss of consciousness. It could be just not acting the same. So somebody who is very mild mannered may become very aggressive. Somebody who's very, very shy may all of a sudden become incredibly hyperactive. You can also develop specific neurologic signs, but if you do have that occur, that tends to be more negative, and you need to watch those a lot closer. But it tends to be more of that global phenomenon. People will describe, I saw stars, I'm not feeling right, I feel nauseated, I want to throw up, I'm sick to my stomach, I uh, difficulty sleeping. Sometimes people do throw up, and balance issues, coordination issues. People will forget plays whenever, and they'll. This is the in the movies, the if they ever make fun of it and things like that. This is when the guy runs the opposite direction and scores for the other team. That it really is just about anything you can imagine. It can potentially become a symptom of a concussion.
Gotcha. So I was under the impression prior to um, preparing for this video that it was a crack in the skull was considered a concussion. So is this something that you can see as it on imaging? Even is a concussion something you can see on imaging?
Not yet, not yet. Now there are like in some tertiary care centers, like under investigative things, they have imaging which can that can show potential things, and they're trying to map neurons, but that's at such a low level, not with conventional imaging. So CAT scans, MRIs, and the like really don't show concussions. Now, if you've sustained a concussion and your doctor ordered a CT or an MRI, or you went to the emergency department and they ordered that, they're looking for other things. Concussions don't actually, they typically do not have any type of gross or abnormality, or what you can see at the radiological level that we can see now. If you were to drill down and go into the nerve cells themselves, you probably would be able to see some things, but we just don't have that conventional technology. And additionally, nor does it actually do anything from a clinical perspective, meaning that 95+% of the time, these images, when you do get images, they come back stone cold normal. And so there's very specific things that we look for in order to send people to get imaging for the brain with regards to mild traumatic brain injury concussions. You may have a concussion. You probably will have a concussion if you have a skull fracture like you're describing, but you do not have to have a skull fracture in order to have a concussion. In fact, the vast majority do not.
Gotcha. That is good. That's a good distinction to make. Now, some of these symptoms that you were talking about, is that the only way to diagnose it if you can't see it? And then how early can these symptoms, do we start to feel these symptoms?
Typically whenever you drill down and you really get to asking these athletes what happened, or you watch the video of what transpired, you can tell immediately. These things do occur immediately, though they don't always tell you immediately, but they do. The injury has occurred. And sometimes it's actually not their fault. Sometimes they're altered, and so they don't fully recognize what they're doing, and so they stay in, and it's unfortunate when they do. But in terms of how do you reach that diagnosis, it is a clinical diagnosis, and this is why it's so important to have somebody on the sidelines who knows what they're doing with a concussion, because you don't want to just hold everybody out that may potentially have a concussion. If you have a high index of suspicion, you have to, or if you have any index of suspicion of a concussion, you should. But this is why it's so important to have people that understand concussions that can help out with these situations, so you don't inherently hold people out. But that's why we have athletic trainers on the sidelines. Athletic trainers they know exactly. They've seen this about a bazillion times. They know how to diagnose this, and it's definitely within their wheelhouse. This is why if you can have a physician on the sideline, we typically know what we're doing with regards to it. But even coaches within the state of Louisiana are mandated to have continuing education so that they understand how to recognize the potentiality of concussions on the sidelines. They are required by law to have that. Now, I'll tell you, most of them don't want to diagnose somebody with concussion. They don't want to be saddled with that burden. And so they much appreciate when an athletic trainer or a physician is on the sideline who can help out in that regard. But it is a clinical diagnosis.
Yeah. So like going back to that example of being on the sidelines, let's say a kid's playing football and gets knocked pretty hard, or they take a hard fall on the basketball court, and maybe there's not a physician, maybe there's several things going on the sidelines, but how does a coach or a parent know, or how can they kind of see that from a different perspective as a coach or a parent? What do they need to be looking for?
Well, certainly, the coaches will have at least some baseline understanding of concussions. Um, Parents should be looking for, okay, typically parents are pretty perceptive when it comes to their children. And so they're looking for those changes with not performing as well in the game all of a sudden, especially following a blow to the head or some other blow to the upper torso area. Typically, the coach is looking for similar things. Are they forgetting plays, not performing plays correctly? Certainly, if they become nauseated, if they tell you that their brain is in a fog, or if you specifically ask them, now there's some specific questions that you can ask, and if they don't give you the correct answers in the appropriate way, as well as the correct processing speed for that person, then you're going to want to sit them out for a while and see if this thing kind of rears its head a little bit more, because these things do evolve over time and their symptoms change over time. So if your intuition says they're not acting right, I would argue take them out, check them out.
Right. And so I guess all of this kind of leads up to, what are the consequences of not taking a concussion seriously? What are the long-term effects?
Well, that's a very, very that's a lot. And this is why it's important to recognize it. There's several different things that can happen. The one that you don't want to happen, which is second impact syndrome, which can potentially be life-threatening. That's very rare, thankfully, but that's where you end up with a concussion, and the person goes back immediately into the game, and they continue playing. Their brain begins to swell. They take other hits, and then they essentially they pass away from it. That should never happen. That should never happen. And so, thankfully, knock on wood, I've never seen it in my career. You read about it in the medical literature. That's very, very rare. Most of the time, what you'll see is, if you have sustained a concussion and then you come out, you're going to have that typical sequential progression towards recovery. Not always, but typically. If you stay in and you sustain another hit, then what I typically see is called post-concussive syndrome. That is prolonged symptoms. What you do is you may actually, let's say your typical progression will be somewhere between 7 and 14 days, and that's how long it would take you to get back to playing athletics. Well, you may extend that for 6 weeks, 3 months, etc. A subset of those patients will ultimately need to undergo physical therapy, and even a lesser subset of that would need to be on medication to help control some of their symptoms for either short term or sometimes even longer term. So the staying in a game after you've sustained a concussion can have unfortunate consequences for both you and, when you think about it, your team as well. But for the most part, you and your future.
Right. So young athletes, they may not always tend to, like you said, they may be in an altered state, or they may not be totally like reacting correctly after an injury like that. But sometimes they may feel pressured to stay silent to continue playing. They're out of fear of being taken out of the game, or that maybe there's pressure from parents or coaches to keep playing. And what would you say to a young athlete, or what can coaches and what can parents say to a young athlete that's under that kind of pressure?
Yeah. Well, hopefully it's not I haven't seen it as much from the coaches. It does happen here and there, but whenever I started off many years ago, it was much more prominent, I'd say, within the coaching world per se, to not diagnose somebody with a concussion. That has since changed, and so there has been a paradigm shift, and I'm very appreciative of that. Ultimately, we do what is right for the patient in front of us. Now, if they are altered, of course, then they can't tell you. But that's why it's so important to have that athletic trainer there, or the parents there, because they can recognize the subtle changes. And so when I'm on the sideline, my head is on a swivel, looking at all of these hits, and the athletic trainer who works with these individuals every day recognizes much faster than I do, because I don't work with them every day, that person's not acting quite how they normally would, and they'll pull them off. So that's why it's so important to have those athletic trainers there. They're a very vital part. Coaches play that role as well, and they will sometimes come and tell us that. But I think what I do is, during pre-participation physical examinations, you have to do that at least once a year by Louisiana law. We ask them about concussions. Have you ever sustained a concussion? And we talk to them about, look, it's important that if you get your bell rung or you see stars and they go away, you still need to tell somebody. And oftentimes it is a clinical decision, and hopefully there's no neurologic physical findings that I can find on the sideline. It's just how you feel. And so when that's the case, look, athletes can potentially, not tell you the truth, but they're doing themselves a disservice, and they're doing their team a disservice, because you're not going to perform well. You're putting yourself at risk and at danger for harming yourself, and you're putting yourself at risk for not coming back within the typical time frame of, say, like 7 days, 14 days, whatever the case may be. You could miss the entire season. And so oftentimes whenever you describe it like that, they realize that, okay, I'm not actually helping my team, I'm potentially harming myself. And as opposed to just missing the rest of this quarter, because it's like the fourth quarter or whatever, I could actually miss the entire season. I'm going to take myself out. That's typically, they understand it. When you present it that way. But it also, these oftentimes are team sports. So you've got to get it from the team's perspective, and talk with them and say, look after your friend, look after your playmate. If they're not acting right, speak up, be their advocate. So you have that entire team approach. You've got the coaches looking after them, you got your fellow teammates looking after them, you got your athletic trainer looking after them, and then you've got your parents in the stands, and hopefully a physician on the sideline. And so you've got all these different levels of care that are set up, that hopefully you don't. So that these kids aren't harmed and are safe playing these competitive sports.
Great. And that is the goal, is to keep these young athletes safe so they can have fun. I mean, those are some of people's favorite memories growing up, is playing sports with their friends growing up. And we don't want to do anything to be able to take that away from them. Just again, guys, if you're listening in and you have any questions, we're about to that point where go ahead and put your questions below, and we will get to those in just a second. And Dr. Harrell, I have one last question for you. It's kind of, I guess, off the cuff, but is there any stories or maybe particular instances that stick out to you of patients or just being at a game that something, I guess, just different happened, or something that made you really appreciate the knowledge of the people around you about concussions?
Sure. One instance comes to mind. There was a player at Sam Houston, actually. This was many years ago, who broke free for probably about 70-yard run. He got caught from behind by a free safety and got his head slammed into the dirt. He was known for always popping up. And the first recognition that something wasn't quite right was he just rolled over, sat up, and looked around. And then coaches came out and saw him. He actually was talking perfectly fine and verbalizing everything perfectly well. Went through the entire neurologic testing on the sidelines, and even like cognitive testing, and did perfectly fine. And then thankfully he was on the sideline getting checked out, and then they scored, and then the defense was in at that point. And so he was on the sideline, and he went up to his coach and asked how he got on the sidelines. And that's how they recognized, okay, you're definitely not you're not right in your head. But that individual, to kind of underline what can change with you, this was a very mild-mannered individual, very shy wouldn't be the word, but just kind of just like very, very just a chill individual. Um, but he then started going and asking out all the cheerleaders just nonstop. And so that can happen to you. And I definitely remember that. Actually, I don't remember it because this was me. Whenever I played football, this happened to me, and I found out about this Monday, and I had no recollection of it at that time. It's since come back to me, and it came back to me afterwards.
Did you have a lot of dates lined up after that?
We won't talk about that. You can look at my face and decide how many I actually got.
All right. Well, that's a very good lesson to remember too. That just looking at, I think that's what I'm going to take away from this conversation is just being able to look at what is normal and notice that there is something off. That can be a telltale sign that really need to check this out.
Yes, indeed.
Well, we are not seeing any questions come in right now live. But you guys, what my plan is and what I usually do in these things is if you do have a question later or you watch later, they'll put it in the questions below and I will make sure that Dr. Harrell gets those questions and we will be able to reply back to you and whatever that answer is. But guys, we thank you so much for joining us today and learning a little bit more about concussions. Dr. Harrell, how can someone get in touch with you if they want to make an appointment?
Well, I think you put it down there, it looks like.
I did. It's below here, right here. Yeah, you can call Dr. Harrell's office at 337-494-6767 and make an appointment. You want to tell us a little bit, maybe what age range do you see in your office?
Oh, we see them all. I mean, we are family physicians here. We are, from birth to, cradle to grave. That's what our mission is. And so we take care of everybody. I guess from an athletic perspective, if you're playing sports, I don't care if it's, t-ball or shuffleboard.
It's all sports. Awesome.
And I'll say that we have a lot of, I teach in a residency program, and we have a lot of young physicians that we ultimately would love to stay in our area and become physicians in this area. And I'm teaching them a lot of this information so that they can go out and then become providers for these various schools out here. So if for some reason you want to see anybody here, if for some reason you can't get in to see me because it's difficult, or come see any of us. Even if you see some of these residents, they actually come and talk to me about these cases all the time. And so this is what we do here. We teach our physicians so that hopefully, even whenever it's my turn to in many, many years retire, they can then take care of me.
Perfect. Awesome. Well, thank you, Dr. Harrell. Really appreciate it. For you guys that are joining us, just remember we do these live and on-call videos periodically. So be looking forward to new topics coming up, especially in 2022. Thank you again, Dr. Harrell, and we'll see y'all later.
Take care.